Sure.
Welcome, Dr. Shareef. How are you?
I'm doing well, thank you.
Well, first of all, I just wanted to thank you. I know that you're extremely experienced in internal medicine and dealing with infectious diseases, but yet you've taken the time to speak to us here in Los Angeles in the San Gabriel Valley. I'm the president of the San Gabriel Chamber of Commerce, as you all know, and there's been quite a lot of concern with a lot of our members, as well as the not just business community, but the residents where I live in Arcadia, about what's going on. So I wanted to say thank you.
Oh, no, no problem at all.
So let's just have a brief introduction about yourself so people can know your expertise in this area.
I've been doing internal medicine for about 27 years now, and I work with Loma Linda. So I've had an opportunity to do a lot of outpatient care, and I also do inpatient hospital care as well as post-op management and acute rehab management. So I get to see patients in multiple ways in different settings. So in that way, I've gotten a lot of experience doing this.
And, you know, just in the community in Loma Linda, have you been seeing patients coming in for the COVID-19?
We've had a lot of patients very concerned about symptoms wanting to be tested, and not most of them end up having more of symptoms, you know, that are more likely to be due to common cold or just some congestion, but not necessarily due to COVID-19. But I think that people are definitely alarmed and wanting to be tested.
And, you know, that's a great point that you've made, is that, you know, hundreds of thousands of people die from obesity every year, but yet there's this huge, massive fear of COVID-19. Can you be able to tell us what symptoms a person would have so that they should be concerned enough to go to the hospital?
Well, what's more characteristic for the coronavirus, for COVID-19, is having a fever, cough, and shortness of breath. And that's when they should actually go to be tested. Unlike the flu, you might have body aches, sneezing, runny nose. That's not characteristic of COVID-19 as much. So really, it's the dry cough, not a productive cough, a dry cough with fever and shortness of breath.
Okay, so the symptoms would be dry cough, fever, and shortness of breath. And when you talk about shortness of breath, is it just like, does it feel like you've been running a mile and you just can't breathe? Is that what a layman would understand to be shortness of breath? Because a lot of people get scared. They don't know what that means.
When you say shortness of breath, where you're having some difficulty breathing, so normally if you're sitting, you shouldn't feel short of breath. And if you walk a few steps or walk a block, if normally you weren't feeling any problem with that, and then you start having this sensation that you need to stop or take a break because it's difficult for you to breathe, then that would be classified as shortness of breath. And I think for different people, the severity of how their breathing feels will be different based on how badly the lungs are affected. So early on, someone might have their, you know, some effect on their lungs, but over time, if there's enough fluid in the lungs from the COVID-19, the symptoms can be a lot more severe and they can have a lot more shortness of breath. And eventually that can progress into the very severe, what we call ARDS, or acute respiratory distress syndrome.
And when do you suggest for a person to go to the hospital or to see their primary care? I know in Arcadia, it's completely overwhelmed. We've had so many people. The hospital, you know, at least at Arcadia, they've tried not to accept people from out of the city. They're trying to just take care of people in the city. I mean, what do you recommend in terms of actually seeing primary care versus going to the doctor? I mean, excuse me, primary care versus actually going into the hospital?
I think it's better for people to not go into the hospital, because the risk of now exposing so many more people in the ER or in the hospital setting, unless of course you've gotten to the point where your shortness of breath is so severe you need more urgent care, you know, that hospital would serve you better. But if your symptoms are early on and you're not sure if you have COVID-19 or not, it's better to go to your primary care doctor, and they might be able to better understand, help you explain, whether these symptoms are from a common cold versus actually if they're worried about COVID-19. And the important thing to mention also is, besides symptoms, there are certain people we worry about. If you've gone on a cruise ship, if you've traveled abroad, especially if you've been in Europe or China or South Korea. I mean, some places are hotbeds right now, such as Iran. Or if you've been in contact with someone that you know is actually positive for COVID-19, your suspicion, of course, would be much higher. But if you have not really traveled and you've been mostly at home and going to work and having some mild symptoms, better to just get checked out by the primary care doctor.
You've made a good point, is that if you have a family member that has COVID-19, what should you do? I mean, do you recommend taking care of the family member? It may seem like a ridiculous question to you, but there are people whose family members have suddenly become very sick and they don't know whether they should be taking care of them. Should they just go to the hospital? I mean, what is it that you recommend as a specialist?
I mean, again, if there's severe symptoms, they really should be given, especially if they're elderly or if they have other comorbidities, which means they have other illnesses such as diabetes, or if they've ever had cancer, or they have lung disease to begin with. Those patients who have underlying risk that make it more likely that they'll have severe infection, for them, you really do want them to go get help medically. But if they're milder symptoms, the best thing is to quarantine. I mean, self-isolate. You've got to make sure that if you're worried that a family member might have COVID-19 and they have mild symptoms, it's really, you want to sleep in a separate room if you can. Don't share towels. If you can maintain a 6 feet distance from them and avoid getting any contact, it's the personal contact that you're likely to pick up the infection from, or from the droplets, respiratory droplets. So if they cough on you, that would be a concern. So you want to make sure you maintain that distance, what they call the social distancing of at least up to 6 feet if you can. And of course, wiping off any surfaces and definitely washing your hands at least 20 seconds with soap helps reduce the chances of you picking up that virus. And make sure that you avoid touching your eyes, your nose, your mouth, of the eyes, the lining inside the nose and inside your mouth. So you have to be very careful not to do that unless you've thoroughly washed your hands.
So you've made a good point, and that's just about safety tips. People have been talking a lot about not putting your fingers near your eyes, and also, for example, like eating and putting it in your mouth. Is that, there's almost like many of these statements online, we don't know if they're true. Many of the information put out, we don't know if it's accurate. Is that what specialists are recommending, that you should just keep your hands away from your eyes and your mouth? And why would you have that recommendation?
Well, absolutely, across the board, I don't think it's disputed that you have to keep your hands away from your eyes, nose, and mouth, because that's how the virus enters your body. And again, if you've washed your hands well and you've avoided the contact, you're not going to be, putting yourself in danger. But if you've touched some surfaces that might be carrying the virus, because the virus can stay anywhere from 24 hours, and they say maybe plastic and metal might even keep the virus alive for it can exist 3 days on that. So that's why it's important, to wash your hands regularly, and then definitely do avoid touching those areas, so you reduce the chances of becoming infected.
So the transmission is through many of the porous portions of your body, such as your eyes and your mouth. Is there any other way that it is transmitted?
Respiratory droplets. For example, if somebody coughs on you, then that could definitely introduce the virus into your system.
And what do you do if someone does cough on you or someone does sneeze on you? What would your recommendation be? You know, you're in a public setting, suddenly that happens. Obviously, everybody becomes very scared. But what should you do as an individual, you know, if that's happened to you?
See, that's what's scary, because now everybody is going to think when they're around a coughing person, and that person might be coughing for so many different reasons. They might have allergies, they might have a cold, they might just be coughing because they got something stuck in their throat. But the point is, like, if somebody coughs near you, first of all, we don't even know if they have COVID-19. We don't know, you know, if it really did come and enter our body. But if there's any doubt, it's better to, you know, watch patiently and make sure that you don't develop any symptoms, because unfortunately the virus may not show symptoms early on. Some people may, you know, for 24 to 48 hours not exhibit any symptoms. And I think that's what makes COVID-19 a little scary for everybody, is because unlike the flu, usually with the flu you have symptoms and then you're contagious. With COVID-19, you may be already transmitting even before you've shown symptoms. But if you have any doubt, keep yourself away from people. Keep that healthy distance, as I mentioned. The person who really needs to, you know, wear a mask is the person who has those symptoms, who themselves are coughing or who have a fever, or they might have traveled somewhere. Those are the people who should be actually wearing masks, so that they don't end up coughing on someone else, you know, so that they don't expose more people than needed to this virus.
And I said earlier, we have hundreds of thousands of people that die from obesity every year. But why is there this sudden fear of COVID-19? Is it really that bad? You know, there's been approximately, and correct me if I'm wrong, about 3,000 deaths. But at the, you know, and so you have almost seemingly 100 times that amount of people dying from obesity, and yet why is there this action by the government to control the situation? Why is there the statement of pandemic? I mean, what is this COVID-19? How is it so bad versus obesity, and then we don't really seem to deal with it on a daily basis?
I think there are a couple of reasons why. I think there's this fear and the need to be, you know, really very much more defensive and act preemptively regarding this virus. First of all, you know, we don't know enough about the virus. When you look at something like the flu, or you know about obesity, we know enough things about obesity. We know enough about the flu to be able to say, hey, this is how it spreads, this is what happens, these are the symptoms. I think with COVID-19, because we don't have a vaccine for it, because we don't have medication specifically targeted towards it, that makes us much more guarded. But more than that, you have to realize that it's not just a mortality rate that we look at. When this has been spreading, when you look at China, when you look at Europe and Italy, what happened was there were so many cases that led to, what COVID-19 does is it leads to respiratory failure. And it leads to such bad respiratory disease that now you have to accommodate that many people in hospital beds, and you have to have ventilators for them. So unlike the flu, you might have the flu and then have another complication and pass from that. With COVID-19, if you're severely infected, you go into respiratory distress, you go into respiratory failure. And you know, I was reading articles about how in China they had to have makeshift hospitals because they didn't have enough capacity for the really ill, you know. So people have a higher chance of suffering from not being able to be accommodated. And same thing happened with Italy and even in America. And I think from the physician point of view, when you read articles and you see, oh, you know, in America we might have, I think we have 45,000 bed capacity in ICU. And if we needed to ramp them up, it can be brought up to 93,000 beds. But if you consider the potential of, if this virus spreads, we may not be able to accommodate patients in the ICU if we don't control and contain this virus. That's the concern. But if we do a really good job and contain it and keep it from spreading, you know, uncontrolled, you know, then we won't face that situation. We're not going to be in this panic where we don't have enough hospital beds and where people will be you know, at risk for dying from respiratory distress. So I think that fear of unknown plus the reality of the way it's spreading, the contagiousness. And right now, the mortality rate's a little difficult to assess, but in China, they're saying anywhere from 3.5 to 3.8 mortality. And it's difficult to note what the exact mortality rate is because we don't test everybody. We don't have enough testing kits right now. And we don't know how many people actually have the virus versus how many are actually, you know, we have to be able to look at both numbers of how many have the virus versus how many died from it to be able to get a real assessment of the mortality rate. But it's been pretty high in certain areas, including Italy. And the question is, why is it in some areas there are a lot more deaths versus in other areas they're not? So these are things we're still trying to understand.
So you were saying that there's a 3.5 to 3.8% mortality rate, is that correct?
That was in China, that's what they're reporting. And overall in America, we have to get more numbers to be able to determine what it is. And it's a very difficult number right now to ascertain because it's spreading, but we don't have all the numbers in to see what exactly is happening here in America. We haven't even done that many tests.
Yeah, and you were saying that we don't have enough tests. What do you mean by that? I mean, you would imagine you could go to the hospital and you could get a COVID-19 test. Is that just not currently available or just?
The sad reality is, although we were told that, hey, we have enough test kits, everybody can get tested, that's not the reality. I think that there was definitely a failure in our system. I'm talking about my own experience now as a physician, because we don't have test kits. We're told to swab and, you know, test for influenza and respiratory RSV virus and test for those. And then if we still have suspicion and those are negative, then to send it off to be tested for COVID-19. And my understanding is we still don't have proper test centers readily set up where people can go and just get tested. They're still sort of like, it's still kind of disorganized, if you want to say, where people are confused about where to go and how to get it done.
And the mass hysteria, you know, about purchasing a lot of product, you know, just hoarding as much as possible, hearing, particularly in Northern California, where they have what they're calling sheltering in place, meaning that you basically can't leave your home for 2 weeks. Is that something that is being discussed here in Southern California as well? You know, it's actually a complicated question that we need to unpack. My first question would be, is the mass hysteria, is it warranted based upon what we know right now of COVID-19?
I think that the reaction from the public has been, especially regarding food and supplies and hoarding, has been out of proportion to what should have been. I mean, I understand all of us should be careful when we're isolating ourselves to have enough food, but we also have to be considerate that everybody else needs food too. So hoarding, you know, it's just this fear that the food is not going to be there. I don't think that our production lines and our supplies are going to run out suddenly, so people shouldn't be hoarding. You know, the stores, even if they got cleaned out the first round, they will be restocking. The other thing is to realize that not everybody's going to have COVID-19. If you're in the incubation period and you're clear, you know that you're safe. So going out and now taking all the sanitizers or buying out masks really created a problem for our healthcare system, because people who really need the masks and you know, needed sanitizer are not able to access it in many places. And I know for a fact, even in the hospital, the nurses were putting away sanitizer and masks because they're worried that if they leave them in front of the patient's room, because sometimes we have to wear a mask to go in to see patients for other reasons, the masks will disappear or the sanitizer bottles will be gone. And really, we shouldn't do that, because the healthcare professionals who are in the ERs, the doctors, they're the ones who really need to make sure that they have masks and sanitizers. And the only people who should be wearing masks are the ones who have the symptoms, because we want to prevent them from coughing and spreading the virus. If people who have no symptoms and not even are at risk and wearing the masks, they're not actually preventing themselves from getting the virus. They're actually allowing those who need the mask to not have them. And that's going to create more of a problem long term for us.
And you were talking about the incubation period and the 2-week, I believe you said 2-week incubation period. So are you saying that if you were concerned that you have COVID-19, really after 14 days, based upon the current analysis, you feel that you would be safe?
Yes, after 14 days of incubation and you have no symptoms and you're fine, then you know that you're safe because the virus would have shown its symptoms anywhere, after the 24, 48-hour period, you would start feeling some mild symptoms. Some people's symptoms are so mild, they may not hardly experience anything, and other people's symptoms will be more severe. But even then, 14-day is what is the recommendation for considering yourself to be on quarantine to make sure that you're all right.
Do you recommend, based upon your medical position and your view of having people stay at home? Some of the parents have said, I don't want my kids to go to school. Is that a recommendation that physicians have been making?
I think that is actually a smart move. The reason I'm saying that is because, unfortunately, we learned from the example of other countries that have already gone through it and are going through it. So, Italy went on lockdown because the rate at which it was spreading, they couldn't control it. And the only way to keep a virus from getting out of control and trying to wait and see how much damage it does is to prevent how much socializing is going on, how much transmission is going on. So if you avoid people from going to the gyms where you're going to pick up the germs, if you're going to avoid people from, going to schools, universities, and definitely workplaces, it's very easy to transmit this virus. And as I mentioned, because you might not even have symptoms and still be transmitting it. That's why I think it is a smart move for a certain period of time to have people stay indoors and not go out unless they really need
to. And doctor, you suggested that there really isn't that much availability in terms of testing, but if a person just wants to get tested, is that available for a regular individual to be able to do?
There are ways to get tested. Like I said, you can go to your primary care physicians. There are other places that are testing. It basically involves a nasal swab or a throat swab, and that gets sent off for testing. But my advice is, since right now we don't have such an abundance of testing kits, really save the testing for people who either have that higher risk because they've traveled or because they have the symptoms. If you're not really symptomatic and you just have a little stuffy nose, or you're just worried because you went somewhere in public and now you thought someone coughed around there. I mean, if we tested on the basis of that, then there'd be too many people needing testing. We really should try to make sure that we use some wisdom in who gets tested, at least until we have more testing available.
Well, Dr. Shareef, thank you very much. You being on the front lines, it's so incredible. And it's such an honor just to have you with me. And, I can be able to say, Southern California, we're just so thankful to have individuals like you that are willing to put your own life on the line just to help other people and to be able to control this pandemic. Thank you.
Oh, we're all part of this. And I think just like every individual is doing their part by not hoarding and making sure their neighbors are taken care of. If you know anybody who's elderly who can't leave their home, make sure they have grocery supplies. Because if they're not able to leave their home, it's going to be very difficult for them. So I think whether you're a physician or a nurse or working in a doctor's office in the front desk, or you're even just a community member, make sure that we watch out for each other, because if we don't, then we will have more bad outcomes. And I think we're all part of this, together, and we each play a different role. So eventually this is going to be brought under control. We just want to have it cause the least damage possible until it does get.
And do you know how much longer we should be expecting this type of energy, if you will, in terms of COVID-19? I mean, are we looking? Donald Trump had said today that it could be, well into the summer. Do you think that could happen Is that a possibility?
I think based on how the rates were in other countries and how long it took for them to finally settle down, China's finally settling down, and they've been facing this for the last few months, So I think what they've been going through this January, February, March. So I think only time will tell based on how the spread is occurring. If we see the numbers getting less and not as many new cases, that would be a good indication that we're getting closer to the end. But if the numbers keep rising, we know we're not out of it yet. And that's why we're containing people. So we don't have the numbers rising.
Understood. Well, thank you again for your time. I really appreciate it. God bless you. You're just doing the Lord's work, and you're just awesome. Thank you so much.
Thank you so much for having me. I hope that it helped. Thank you.
All right. Bye-bye.